General Secretary, Kenya Union of Clinical Officers. Here we have all the unions from the health sector, that is the KMPDU, the KUKO, the NUPT, there are very many, the nutritionist, the medical laboratory, public health, among others. Morticians. Yes, including morticians. So I will go first, and I want to make it very clear why we are here. We are here today as healthcare workers to just make a statement that we are dismayed in the manner that the county government have chosen to be disruptive, causing havoc among our members, transferring them arbitrarily, and even demoting them without following the laid down procedure. I want to give a case scenario that a clinician is attacked by a dog, and when they raise the issues, they are being transferred, they are being muted, and yet it is them who were attacked and beaten by a dog. And within the hospital, while they are offering services, we are here because promotion has not been happening. And when our members ask for promotion, they are being threatened. Threatening them, following them with motorbikes. This county has chosen that no healthcare worker can go for further study. They have refused to allow members to go back to school as it is provided under our policies. The other issue, which is a torn issue, is actually the severe shortage of healthcare workers. You find that this country has not employed healthcare workers 7 years down. Our cry always that this disintegration of the health sector is a problem. Then Kisii sets a good precedency that we are in a country of disruptive. Lastly, it is the issues of the of the NHF. You know very well that there have been a lot of corruption happening here, and when our members raise because it is affecting them, they are being threatened.
My name is Dr. Davji Bimji Atela, the National Secretary General for KMPDU, and also the Secretary to the Caucus for Health Workers countrywide. We've had deliberations with health workers in the sitting today, and we are disturbed at the frustrations, the exploitation, the intimidations that are working at the workplace. Their dignity has been lost for the last 2 years that the government of Kisii County has changed. We have a situation where doctors who are doing their work and get sick the salaries are being stopped arbitrarily, yet they're sick. We have consultants that are working in very poor conditions. We have tried to have engagements with the county for the last 15 months with no results. So in our today's deliberation, as unions, we have sat down and we know that the ultimate power of workers comes with the skills that they have learned. And today we are issuing a 14-day strike notice to Kisii County that will commence on 4th of March if the issues that we had taken to the government have not been addressed. That is, the doctors, the health workers who are being victimized has not stopped. That is, the salaries that have been stopped are not reinstated. That the consultants and all the health workers have not been designated to the right positions and also promoted to the right places. So we are not begging as unions, because when we lose that right to strike, then we become collective beggars. But we know that we have the right to bargain. And therefore, on 4th of March, 2024, all the health workers in Kisii, if the issues that we have mentioned are not addressed, there will be no anybody in the hospitals.
Solidarity forever. Solidarity forever.